Bismillah ar-Rahman ar-Rahim. Pulse dye laser and its applications. This is contents of my lecture. Cutaneous vascular lesions are one of the most common indications for laser treatment in the dermatology. The target chromophore in the treatment of vascular lesions is oxyhemoglobin. The peak oxyhemoglobin absorption are 418, 548, 577 nanometer. This is the diagram. Show us the peak of hemoglobin and peak of melanin and peak of water. We see the water is always in infrared spectrum, infrared. The hemoglobin and melanin together, they are near sometime. There is competition. We will talk about that later. To minimize thermal injury to surrounding structures, the laser pulse duration should be equal or shorter than the thermal relaxation time of the target, TRT. Many lasers have been described for the treatment of vascular skin disorders with variable efficacy and safety. The first major advances of vascular laser was argon laser, 488 nanometer and 514 nanometer. The another laser was argon pumped tunable dye laser, which wavelengths adjusted to the yellow range, more selective for blood vessel, 577 nanometer or 585 nanometer. But the risk of atrophic of hyperatrophic scarring was as high as 25%. Copper vapor laser and copper bromide laser are continuous wave mode laser that deliver yellow light with wavelengths 578 nanometer. In 1989, the introduction of pulse dye laser it became the treatment of choice for port wine stains, hemangiomas, telangiectasis, and others. Pulse dye laser uses argon dye liquid as medium. Pulse dye laser emits high energy in ultra-short pulse duration with relatively long intervening periods between pulses. PDL work by delivering an yellow light that absorbed by blood vessels. This light converted to heat, causing vessels to heat up and shrivel, while leaving the surrounding tissue unaffected. This causes a bruise which fades over 1 to 2 weeks. The first PDL emit laser light at 577 nanometer, which coinciding with the last peak of oxyhemoglobin. The last one is 577 nanometer. In the future, by lengthening the wavelength of PDL to 595 and 600 nanometer, which has deeper penetration into dermis, which also suitable for treat large ectatic vessels which seen in resistant adult port wine stain. In order to compensate for degrees absorption with 595 is far from the peak of hemoglobin, we must increase the energy 20 to 50% compared to the 585 nanometer PDL. Now we will talk about indications of pulsed dye lasers. The most popular indication is vascular abnormality, which include hemangiomas and port wine stains. Lesions that are present at birth and appear to grow at the same rate as body are usually vascular malformation like port wine stains, whereas lesions that develop within the first few weeks of life and increase asynchronously are typically hemangiomas. First of all, I will talk about hemangiomas. The 80% of hemangiomas are single lesions. Usually, radiography imaging is not necessary for single hemangiomas. Complication of hemangiomas include ulceration, bleeding, scarring, infections. The treatment of hemangiomas are multiple. The therapeutic intervention should be considered for the following reason. First, compromised airway. Second, visual impairment. Third, oral gastrointestinal obstruction. Fourth, auditory involvement. Bleeding, ulceration, and fascial involvement are other indications for aggressive interventions. Various therapeutic options have been explored for the treatment of hemangiomas, like cryosurgery, sclerotherapy, intralesion, or even injection of systemic steroid, interferon alpha, beta blockers. Many things has been used. Laser provide an important therapeutic approach for hemangiomas. Pulse dye laser is regarded as the treatment of choice for only superficial hemangiomas. In 2010 study done in Cairo showed the application of PDL 595 followed by NDIAG 1064 can be considered a superior method for management of infantile hemangiomas, especially on face and neck. Second, capillary vascular inflammation, which is port wine stains. Port wine stains are type of capillary vascular malformation which present at birth. They can vary in size from few millimeters in diameter to greater than 50% of body surface. 50% of port wine stains affecting the face and are restricted to one or more of trigeminal sensory regions. The more extensive the cutaneous involvement, the more likely that there is underlying neurological, ophthalmological, or other systemic abnormalities. Histologically show ectatic dilation of normal number of capillaries within normal endothelium. That's mean normal number of capillaries. The initial flat pink red patches evolve into cobblestone purple plaque and nodules are result of progressive vascular ectatic by the 5th decade. Treatment of port wine stain. The flash lamp pulse dye laser 577, 585, 595 is an excellent treatment option for port wine stains. The monochromatic yellow light is selective absorbed by oxyhemoglobin, which is in the capillaries. The first pulse dye laser utilized a pulse duration 0.45 millisecond, which is less than TRT of the vessels. This is very important. Treatment protocol vary, but typically between 6 to 10 sessions we need at 6 to 12 weeks interval. The wavelength was increased to 600 nanometer to increase the depth of penetration in attempt to treat slightly deeper vascular lesion, which we will talk together about superficial leg veins later. Using 595 PDL with 1.5 millisecond pulse duration at 11 to 12 joules centimeter, improvement greater than 75% clearance of port wine stains in 63% of patients achieved after 4 treatments. This is new study. The early treatment of port wine stains the best response due to thinning of the skin. Hypertrophic and nodular port wine stain with larger and deeper vessels don't respond as well as flat lesions with pulse dye laser. Nodular port wine stain were reported to respond better to 1064 nanometer in the YAG than flat port wine stain after 1 treatment. Reactive erythema after makes the border of affected lesion and unaffected indistinct. The treatment is associated with purpura that lasts from 7 to 10 days. Outlining the involved area with marking pen or treating the edge before, then the central after, can facilitate the treatment and prevent inadvertent treatment of unaffected adjacent skin. Parameter of PDL for port wine stain. First, spot size, larger spot size, more penetration. Second, pulse duration from 0.45 to 1.5 millisecond. Third, energy, generally high energy, more effective. The introduction of selective epidermal cooling, including forced air, cryogen spray, and contact cooling, has allowed the use of higher energy in PDL. Many options to treat resistant port wine stain, like using NDIAG laser, long pulse Alex laser, EMICI mode with PDL, 810 diode laser, PDL with longer wavelengths, pulse duration 1.5 even to 40 millisecond, energy fluence until 15 joule centimeter square, spot size of 7 millimeter. Even we can use pulse duration, we use a stacking pulse. Yani that's mean more than 2 to 3 pulses together for the flat pink port wine stain. For darkened skin, it is recommended to wait 3 months between treatment sessions. Venous malformation also indication for treatment of PDL. Are low flow vascular lesion affecting the head and neck region, and those involving in limbs may require treatment because the risk of adjacent structures or facial distort. As reported, small venous malformation has 7 to 100% clearance after 2 to 8 treatments. Now we will talk about very important indication, facial telangiectasia. Simple facial telangiectasias are small dilated vessels that are 0.4 to 1 nanometer in diameter, commonly located on mid-face region and appear as linear red or blue vessels. Spider telangiectasias consist of red radial branches emanating from a central arteriole that blanch with pressure. Alcohol, estrogen, corticosteroid, chronic actinic damage can precipitate onset of telangiectasis. Trauma or post-operation resulting from excision, facelifting, rhinoplasty can also promote new vascularization resulting in telangiectasis. Telangiectatic vessels are predominant feature also in rosacea. The treatment of facial telangiectasis and erythema is one of the frequent indication for cutaneous lasers, PDL, KTP, NDIAC, IPL also. Pulse dye laser with variable pulse duration ranging from 0.45 to even 40 milliseconds are very effective in treating facial ectatic. Parameter of PDL for treatment of facial telangiectasia varies according to the size and to the depth of the vessels. I will tell you about some parameter we use it, like in laser 585, we use pulse duration, we can use 3, 6, 10 millisecond, energy 6 to 9 joule centimeter square, spot size 7 millimeter. In PDL 595, we can use 1.5, 20, 40 millisecond, energy 7 to 14 joule centimeter square, spot size 7 millimeter. The main percentage of facial telangiectasia vessels clearing following a single treatment improved from 67% with non-overlapping pulses to 87% with purpuric treatment. Laser therapy for acne rosacea, I will talk now about rosacea, has been utilized for the reduction of telangiectasia and also reduction of erythema. Short and long pulse duration, I mean short 585 to 595, sorry, this is wrong here, correspond closely to the absorption peak of exohemoglobin with pulse duration from 0.45 millisecond to 6 millisecond of pulse duration. Now, recently, sub-purpuric treatment, we use it in, we make low fluence and long pulse duration. We can achieve sub-purpuric treatment. Has been shown to be less effective, but most patients will choose the last option rather than purpura. In rosacea, we can use subpurpuric treatment, like we can use 10 millisecond pulse duration, 10 millisecond spot size, fluence from 6 to 7.5 joule centimeter square. Also in rosacea, for subpurpuric treatment, we can use 595 nanometer, 20 millisecond pulse duration, 7 millimeter spot size, and fluence ranging from 8 to 11 joule to centimeter square. That's mean when we are make the pulse duration more, we can increase the energy more. Now scar, pulse dye laser are proven effective in the treatment of hypertrophic scar and keloid due to thermal injury to microvasculation in the scar. Also, PDL control the degree of angiogenesis and introduce also the tumor growth factor B expression. Cherry angioma, also indication of PDL. Cherry angioma, we know that will circumscribe small red papule composed of vascular ectatic appear in early adulthood and tend to increase with age. With PDL, purpuric dose are necessary and patients should be warned that bruising will occur post treatment for 7 to 10 days. Venous legs are Varicosity dilation vessels result from weakness of pre-existing vessels walls. They appear like blue papule on the face, especially we see always on the lip in older patient, most commonly on the lip and ear. These lesions are also well response with KTP, PDL, argon laser, NDIAG laser, and IPL. Nevus simplex. We know always nevus simplex, which is named salmon patch, is a vascular birthmark that's seen in 25 to 40% of newborn babies. Area of involving include the nape of neck, lateral, and the eyelids. Lesions fade spontaneously by age 3. For persistent lesions, treatment with PDL is very effective. Energy delivery at purpuric dose, similar to port wine stain, better efficacy in fewer treatment. Other also indication of pulse dye laser, plaque psoriasis, studies PDL on psoriasis, the response for recalcitrant plaque psoriasis and periangular nail was from 57% to 82% clearance. Leg veins. Leg veins, we can use 595 nanometer, showed slightly better result than 585. Fortunately, nowadays we have laser which contain PDL and NDIAG together to treat deep and superficial vessels from 0.3 to 3 nanometer in diameter. Viral wart. In recalcitrant viral wart, also we can use pulse dye laser alone or with also even with many things. Viral wart 595 nanometer, energy from 8 to 12 joule centimeter square, pulse duration 1.5 millisecond. In this case, we use always high energy. PDL has been used to treat recalcitrant viral wart. Treatment done in 2008, we saw the success rate 6.7 on flat wart, 5.1 in periangular wart, 47% on plantar wart, 44% on common wart. A replacement of PDL treatment should be considered unless improvement is observed after 3 sessions. That's mean when we see if there is 3 sessions, no improvement, we can convert to another treatment. Lymphangioma circumscriptum, sorry, this is wrong. 595 also tried with energy 15 joule centimeter square, pulse duration 0.45 millisecond, also has good result. Red stretch mark, only we can use the redness of stretch mark. Also, we need multi-subpurpuric treatment, multi-sessions. Biogenic granuloma, we can use also 595 nanometer, energy 7.5 to 8.5 joule centimeter square, pulse duration 0.5 millisecond. Poikiloderma of CVAD, which is manufacturer of photoaging skin and affect neck and chest, we can use 585 energy, 4 to 6.5 joule centimeter square, pulse duration 3 to 6 millisecond. An improvement of 50 to 70% was seen after 2.5 sessions. We can also use PDL, chronic photoaging skin. We can use it in granuloma faciale. We can use it also in red acne scar. We can use it in discoid lupus erythematosus and many other. Also, I heard we can use it also for diarrheal disease. Side effect and complication of pulse dye laser. Complications from pulse dye laser are uncommon. Generally, hypopigmentation, which occur in 2.6% of treated patients. Hyperpigmentation, which is very common in dark skin. Epidermal atrophy result from overlapping of treatment pulses or treatment of young children with excessive fluence. The current 595 nanometer pulse dye laser, which long pulse duration and cryogen spray cooling, have made this complication rare. By make the wavelengths more long and by make the pulse duration also more long, and also cryogen spray, which has many advances. Question: can PDL treat pigmented skin lesion? We know that visible and UV light are mainly absorbed by melanin and hemoglobin. PDL 595 and 605 nanometer has been used for treatment pigmented epidermal lesion, not dermal, epidermal lesion like freckles, solar lentigos, seborrheic keratosis using 1.5 millisecond. Why we are using 1.5 millisecond? because we must be close to the TRT, thermal relaxation time of pigmented target within the epidermal layer. Fluence 7 to 10 joule centimeter square, 7 millimeter spot size with compression. We use compression when we treat pigmented laser to display the blood away from irradiated field. You see, now we use pressure to have only the melanin chromophore and go away from the blood vessels. This is after treatment freckles or solar lentigo PDL. Now I will show some photos. This is hemangiomas before and after. Of course, we need many sessions to treat. This is using for red acne scars. This is also for treatment of red acne. We are using PDL for removing the color of scar. This is after port wine stain on the chest. We need, I told, from 6 to 12 treatments. This is after 6 treatment only. That's mean for childhood we use less number of treatments. This is nose vein. This is also port wine stain of adults. We see there is not 100% clearance of port wine stain. This is rosacea. The PDL improved the redness and telangiectasia with rosacea. This is photoaging skin because we know that photoaging there is more vessels. This is for leg veins. We see that the big, deep vein not response, only the superficial veins. We use sclerotherapy in this case and Nd:YAG laser. This is viral wart. There is some pulse dye laser machines. V-beam has 2 machines. We know that Perfecta and V-beam, and Cynosure have V-star, both emitting wavelengths 595 and also 585. They are now making the pulse duration more, until 40 milliseconds. We can treat the big vessels and it is more safe for dark skin. This is V-star Cynosure. This is V-beam 585. This is V-beam Perfecta 595 and pulse duration 40 milliseconds. Thanks very much.
We will have 2 questions. So we prepare those from outside to if you have any question.
After treating warts medical, can you leave the scar?
There is ability for scar.
But there is a scar after.
There is scar because I have, no experience, but because we use high energy, I think there is ability for scar because we use high energy in wart. I have not too much experience, only maybe have 3-4 patients, but I think the scar is more.
This spider fly and the telangiectasia, which give good results? Sclerotherapy or?
This is according to diameter. This is according to diameter. When there is a small red telangiectasia, better PDL. When there is bigger blue, for my experience, sclerotherapy or Nd:YAG laser.
Which is sclerosis?
What?
What is the sclerosis?
There we have many. There is many trade name. If you want, I will give you later. This is IPL for leg vein. We use it only for small red vessels. Nowadays, really, I am using now more Nd:YAG. For me, I see that more effective because deep penetration. You understand me? Only I use it for facial telangiectasia more than leg veins. The effect more. Because Nd:YAG in the face makes scar. Too much dangerous in face. So for me, I use PDL on face and Nd:YAG on leg veins. More effect. IPL? See, but the result, we need too many sessions. I use IPL for nose if the patient don't need purpura. But for me, the effect PDL more. IPL good more for rejuvenation, more for rosacea, more. Effect is more for erythema. For telangiectasia, the PDL less session we need, less. But the problem is purpura, so that we can use IPL if the patient don't want purpura. We have two choices, IPL or PDL subpurpuric treatment. How we can achieve? By make the fluence less and make pulse duration more. We need more session with subpurpuric treatment, but sometimes the patient request that he don't want purpura. They have party, they have work, so that I use IPL in this case of PDL subpurpuric treatment. Yes, of course, because it's too much painful. There is any question?